let's talk about thumb injuries. I know that that Megan shared a lot with you guys last week in terms of some anatomy, kind of thinking through some of the cases. What are some common thumb injuries? And we're gonna go into a little bit of testing, like from a clinical testing, from a evaluation perspective, right? You wanna know how to evaluate. We already know pain, we already know range of motion, we already know pinch and grip, right? We already know those, but there's some other testing that you want to consider. And what are some common thumb injuries that you guys treat, so we can make sure that it's you know, that it helps you and it's appropriate. Types of issues, right? Anyone get ligament, like what else? Trigger thumb, yep. Trigger thumb, arthroplasty of the CMC. Yeah, so that goes back to that one. So arthroplasty is post-surgical. So when you're post-surgical, you don't necessarily test. Well, that's not true. You can test for stability if there was a problem, right? You just have to know what to look for if, you know, if the patient started to move too fast, right? Or they got, you know, something is a little bit out of place. So ligament repairs, injuries, and then usually a repair. So anytime you're post-surgical, you always want to think about, you know, how every once in a while, how do I test back to see that they're still stable? So the easiest one is trigger thumb. So the funniest thing about the thumb that you have to be careful about is at the base of P1, we have these sesamoid bones that the flexor pollicis longus goes through, right? And what those sesamoids do is they hold that tendon there. So the key thing is not to confuse that bump and that ball with, oh, they have trigger thumb, right? So what you, so the A1 pulley is just a little bit lower that you're feeling for, right? And then you're getting them to flex, and then the tendon glides down that pulley, and when they go to extend, it goes up, and that's where you can feel or see or hear the clicking. Now, trigger thumbs, just like in the fingers, can go from mild, moderate to severe. So what happens is, if you think about it, if it's mild, moderate, severe, when it's mild, it can become really painful, and then, but you don't hear the clicking. So that doesn't necessarily mean that you don't have one. But one thing that I would encourage you to do is think about what are the surrounding muscles, right? What are the surrounding muscles? And a lot of times people they just have a lot of thumb pain, don't they? They have a lot of thumb pain. So you have all your little thenar muscles right here, and then you have that adductor, right? Your thumb adductor. So make sure that you can test if they have thumb pain. And what you want to do is you want to palpate around the muscles, right? So here's the proximal end of those muscles, just like you would, like if you had a long tendon, you touch that one end, then you can come down into the belly of the muscle, and then you can move down, right? So in the thumb, the same thing. It's just the tendons are really short. So what you want to do is you want to feel, like a lot of times I'll go right into that meat, and I'll feel for it to see if it hurts, right? And then you can come from very radial to then more and more into the medial. And the thumb is really interesting because you can get to it on both sides. So I like to test for musculature around that metacarpal for the thumb. I like to test, so we know that that flexor pollicis longus comes all the way down, right? And then it hits that A1 pulley, and then when they come up, that tendon comes back up. And sometimes that tendon doesn't get really long, right? It's not as long as it could be. So one of the best things that you could do is you can make sure that the MP goes into extension, the IP goes into extension, and then what you want to do is you want to control that and then bring the wrist all the way back. Because guess what? That flexor pollicis longus passes through the wrist, and if you don't control it and then move the wrist, sometimes you can't see if it's like the muscle tendon is just really tight, right? Obviously, when they're moderate to severe, they can they'll click. And what do? We have to stop the clicking. So a lot of times people ask, well, how long do you wear the splint? All the time. So you can't just stop it during the day and let it click at night. You have to stop the clicking all the time. You have to stop the clicking for 4 to 6 weeks. It takes quite a bit of time. And so that's why some people are they're very quick to do injections. They're very quick to do surgeries. I've gotten rid of some of the most severe trigger fingers conservatively. So just know that it's possible, right? The people who are finding me because they don't want to have surgery, right? But a lot of times they're going to find therapists to help them and say, okay, should I get it? And is it possible? So the answer is yes, it's possible. It's like, how willing are you to work on it to make sure that you can get it better without it getting worse.
Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.